Hi, my name is Caleb Osorio, and for today's presentation, I'm going to be talking about HIPAA and reporting a colleague's HIPAA violations. So, what exactly is HIPAA? HIPAA, or the Health Insurance Portability and Accountability Act, is a federal law passed in 1996. The act established federal level standards regarding the protection of the disclosure of a patient's sensitive health information. Leading into the 21st century, two main things were also established, these being the HIPAA privacy rules and security rules. HIPAA privacy rules are standards for covered entities regarding the use and disclosure of individuals' protected health information. These covered entities consist of healthcare providers, health plans, healthcare clearinghouses, and business associates. HIPAA security rules are similar but hold covered entities responsible for the protection and confidentiality of electronically available medical information, and as the name suggests, the security for the system to house this information. So, why is HIPAA relevant to us? HIPAA is relevant because it protects the privacy and security of all patient health information, ensuring that covered entities, like healthcare providers, are operating under legal standards with regard to our sensitive medical information. And now that we know what exactly HIPAA is and why it's relevant to us, we're going to be talking about some pros and cons. To start with the pros, we have confidentiality between patient and covered entities. As we covered previously, the disclosure of medical information are only available to the patient and whoever they willingly sign off to. And this can even exclude at times medical proxies if the information isn't necessary to make a decision for the patient. For the next point, we have standardizes healthcare processes. Some examples are electronic healthcare transactions, eligibility verification, and claim submissions. And for the final point, we have it promotes transparency between patients and healthcare providers because of the level of confidentiality that HIPAA offers. Moving on to the cons, we have three more. To begin with, we have information sharing barriers. Sharing between offices and providers can be time consuming or difficult because of long processes. For our next point, we have public health emergency challenges. For example, during COVID, had it not been for temporary changes to HIPAA, the spread of information and access to healthcare services would have made it slower to deal with the pandemic. And for the last point, we have proper training difficulties. The content is often long and boring, and most training models are generalizations and can lead to accidental HIPAA violations by inexperienced healthcare workers. So now that we've gone over some pros and cons with regards to HIPAA, let's talk about some unintended and intended consequences. So to begin, we actually have an indirect unintended consequence, which is the development of telehealth. So this indirect unintended consequence actually is because of COVID-19 and the way that HIPAA reacted to COVID-19. So obviously during COVID-19, we weren't allowed to leave our homes, and one of the services that healthcare providers offered was telehealth, which is just meeting with patients through a FaceTime or calling them, and disclosing medical information through those channels. And obviously, that's not something that would typically be allowed, but during COVID, HIPAA actually made an exception for some of these third-party softwares like Google Meets and Zoom to be used in telehealth. Because of this, obviously, telehealth was really pushed during COVID, and if you're feeling any symptoms, you could just have a telehealth meeting with your doctor, and all you had to do was just call or join the call, and you would get your help, or you would get your diagnosis, or you would get help with whatever situation you were in. And a lot of people actually really like this, and a lot of doctors actually really like this because it was easy to meet with a lot of patients in the day, because all they had to do was just join the meeting, wait for the patient to join, talk about their symptoms, and then go about their day. And for the patients, obviously, it's easier, especially for patients who were at risk, of high risk during COVID, and also just patients who are physically physically unable to go to a doctor's place, because of difficulties with regard to their health. So this was really good for those two different groups. And even after the lockdown was shut down, HIPAA gave these services like a grace period for them to transition back away from telehealth back to in person, and a lot of healthcare services actually really like telehealth, so they're actually pushing for telehealth services to be more accessible to a lot more people. And also something that was really great and happened during COVID was in 2022, Zoom actually became HIPAA compliant. So now Zoom can actually be used for healthcare services or telehealth. Um, and we've seen even, Zoom has even gone as far as being used for like court cases and stuff. So, COVID and because of HIPAA's regulations, they really push for the, certifications of certain programs that which are now being used to push telehealth. So for our second point, we have family or caregiver access information difficulties. So a point that I brought up during my pros for HIPAA was that obviously that a lot of information is confidential, right? And that at times even medical proxies aren't privy to all the information regarding a patient. So this can be troubling, obviously, because if they need to access certain information to make certain decisions, obviously they won't be able to because HIPAA's like very tight hold over medical information, and they really push for the consent being given specifically from the patient. So if the proper like paperwork isn't filled out, then sometimes it can be hard to access that information. And there's actually something you can sign off with through HIPAA that discloses medical information to whatever person you like. And our third point actually kind of ties into the previous point, which is the fear of violating HIPAA guidelines. So because HIPAA has a very big hold over the industry of medical information, obviously they come with a lot of penalties if it's being violated. So obviously healthcare service providers will be hesitant when giving out information, especially if the legality of it is murky, and this comes obviously to family or caregivers. So that's why it's you have to, if you want to give access somebody to your medical information, it's recommended that you just sign off of it through HIPAA so that there's no complications there and all the paperwork is done, because sometimes these medical healthcare providers can be afraid of being possibly charged with something for violating HIPAA guidelines. So moving on to intended consequences, we have privacy protection, which we mentioned before. We have healthcare trust, which again we mentioned before. And for the last point, we have standardization of healthcare transactions, which you also mentioned before, which was obviously, the medical documents, the balances, and the eligibility for certain programs, which are all that. So, moving on to pending actions, we actually have some things that are being changed in HIPAA right now, or that are, were set into motion by the Trump administration back in 2020 when it was first elected. They kind of pushed for certain things to be changed for HIPAA. And now that Trump's back in office, it's kind of under his control what's going to happen next, and right now we're just awaiting for him to make his move on these certain things. And some of these proposed updates are shown here on the screen on the right. So some of them are allowing patients to inspect certain to inspect the information in person and taking pictures of them or taking note of them. I know specifically for me, when I go to the eye doctor, if I want to get the ratio for my prescription for my glasses, I wasn't allowed to take a picture of it. I had to wait for the doctor to write it out and then send it to me, even though they had it on file. So those are some things. Changing the maximum time to provide access from PHI from 30 days to 15 days. So those are just some of the examples here. And then for my scenario, so my ethical dilemma and my scenario are: Dr. Bob is a cardiologist whose practice needs more patients to give him the income level he desires. Dr. Bob uses his access to the hospital records to look for potential patients, and then he visits them, even though they had not requested a consultation with him. And he even orders tests on those potential patients to be performed. Dr. Sam, a friend of Dr. Bob and head of the ethics committee, has found out that Dr. Bob is doing this, which is a major HIPAA violation. Dr. Sam is seriously considering reporting Dr. Bob to the rest of the ethics committee, even though he and Dr. Bob are friends, and the violation is likely to result in a severe consequence for Dr. Bob. And my dilemma is it ethical for Dr. Sam to reveal to the entire ethics committee what Dr. Bob has been doing? And yeah, that's my dilemma, and that's my ethical, the background behind it. And here are some of my sources that I used. Yeah, so that's been it. I hope you guys learned something. And yeah.